Aorto-Bifemoral Bypass. Introduction.
The arteries can get clogged with plaque. Select true or false. Correct. As the plaque layer thickens, it becomes more difficult for the blood to reach the organs.
Severe leg pain, especially after walking, could indicate that arteries in the lower abdomen or upper leg are clogged. Select true or false. Correct. Severe leg pain, especially after walking, could be a symptom of clogged arteries in the lower abdomen or upper leg.
The aim of this operation is to increase blood flow to the legs. Select true or false.
Correct. By bypassing the clogged arteries with the graft, blood can again flow freely to the legs. Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Blood clots in the legs after an operation are harmless. Select true or false. Correct. Blood clots in the legs are very dangerous, even though they are unlikely to happen. The symptoms may include swelling of the leg, shortness of breath, and chest pain. Very rarely, however, a blood clot can go to the lungs and cause death without giving any other symptom. Are infections very common after surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections as well as bleeding and scarring may occur. If a deep infection occurs, the graft may need to be taken out and replaced.
Is it impossible to injure the stomach, intestine, kidneys, and liver during this operation? Select yes or no.
Correct. It is very unlikely but not impossible to injure the stomach, intestine, kidneys, and liver during this operation. These and other complications, though very rare, could lead to permanent paralysis or even death.
Is injury to the kidneys, bladder, uterus, or ovaries common during this surgery? Select yes or no. Correct. Injury to the kidneys, bladder, uterus, or ovaries is rare during this surgery. Although these risks are rare, they can still happen.
The operation tends to be very successful. Select true or false.
Correct. The operation is very successful. However, the graft could get clogged and require another surgery. Thank you for using Explain.